Good evening, everyone. Let's go ahead with our class. We will be studying today aphorism number 50. I hope I am audible to everyone. Can you hear me? So, before we start with the aphorism 50, let's just have a recap. We were studying with the interaction of natural diseases. In this natural diseases, it covers whatever the naturally occurring diseases and the diseases which are being introduced as inoculation and as vaccination. In one of the previous videos, I told you the difference between inoculation and vaccination and what are the meanings also I discussed. As I told you that in this doctrinal part 1 to 70, apart from the physician's aim and objective, we studied about the basic blueprint of case taking. Then we understood the dynamic aspect of disease, medicine, cure, health. Then we came to know about the doctrinal part of knowing how to know the power of medicines. Then from aphorism 22 onwards, we have been studying about the therapeutic law. Henman told us about basically two laws. One, the law of similia and the law of contrarium. And he explained in detail about his exploration of both the laws. He told us that how when two dissimilar diseases meet together, what happens? He told that three conditions occurs. And he, with examples, illustrated us that in these three conditions, there is no such cure takes place, but the stronger one is suspending the weaker one. Or they form a conjoint malady, they form a complex disease. But the most important point is that it does not make anyone to distinguish. No one is distinguishing the other. Then he told us about what happens when two similar diseases meet together. And in that, he gave 11 examples in the aphorism 46 to illustrate the weaker one is being distinguished by the stronger one. And that's only the law we should follow. But mind it, here in these aphorisms of interactions of diseases, which started with aphorism 34 onwards, whether the similar disease meet together or similar disease meet together, whatever the doctrinal part, the principal part, and the illustrative part, the examples of it. One thing is that he is within the realm of natural diseases or some kind of inoculating disease or vaccinating one. In somewhere he is into those diseases and seeing the interactions of that. Now, in this aphorism 50, he's going to discuss he's going to discuss about so he is just discussing with the interaction of the natural diseases, but as such, no therapeutic means he has discussed with us so far. And in this aphorism 50, he is going to discuss with us that what are the disadvantages if we leave the operation of cure to the nature, and that too of similar kind of natural diseases. You understood my point? What is aphorism 50? He is going to tell us in aphorism 50 that let us take it as granted that all right, uh, in the natural diseases interaction, the similar one are going to be good as a law, and if we simply leave, or if we just make the ill person, sick person, just subject to the natural disease, similar natural disease, we make such conditions that person is going to have similar natural disease, even if we try to do so, whether it is advantageous or disadvantageous. So for sure, it is disadvantageous. What are the reasons? What are the points Hahnemann is mentioning in this aphorism 50, that how leaving the sick humanity to the nature subject to similar natural diseases even is not advantageous, not useful, not going to improve, or it is hazardous. How? What are the points it is going to be hazardous for the suffering humanity if they are left with the similar natural diseases? This is a point we are going to learn in aphorism 50. See how very step by step manner Hahnemann is teaching us and giving us the wisdom of understanding he has attained over the period of time in his experiments and experiences. And I don't think that he is leaving any kind of question or a stone unturned. Whatever the reader or the practitioner or the listener may think. See how he is meticulously coming to a point, like when he is saying so advantageous to have a similar natural disease, the stronger one, it will remove the weaker one. Good enough. Then leave it to that only. He says, no, it is hazardous. Why hazardous? He is giving some 5 points to understand. So, what are those 5 points which are really hazardous for the suffering humanity if we leave them to similar natural diseases. The 5 points are: one, are we having enough number of natural diseases for this operation of cure? We do not is human race is going to suffer. Are we having enough number of similar natural diseases to which we can leave this suffering humanity, make the arrangements to have some stronger similar natural disease to cure the natural disease patient is coming with us. Suppose a group of patient comes suffering with a disease, are we having another similar disease like A? If suppose diseases are A to Z, are we having these many number of stronger similar natural diseases? First of all, it is a question of numbers. Then, what is the second point? The second point is the safety. Is this safe? Suppose somebody is going to suffer with disease A, and I find, all right, this disease A is going to be cured by measles. So I make an arrangement so that this person suffering with disease A should suffer with measles. Is this safe? Are you not really looking the safety issues here? He may suffer with the uh, measles, which is going to cure disease A, but then at the same time, the issue will come that how this measles will go away. After all, it is another natural disease. It has to complete its course. And you do not know that whether it is going to complete the course very calmly and peacefully or going to leave the footprints. I mean, the sequelae, I mean, the complications. Similarly, another point is, all right, we may see that it is peacefully going, measles going away peacefully, completing its course. But are we sure about the duration of it? So, the first number point is number of diseases are we having to apply in the nature. Secondly, the safety. The third is the duration, for how long this measles is going to complete its course, for which we as a physician are not sure. Then another point is that are we having any such experience that how many of such natural diseases going to be cured by stronger natural diseases? We don't have any kind of experience or the experiment or the data that measles is going to cure 1 to 10 disease or 1 to 100 disease. Then another point comes, can we manage the strength of the dose? Like in the nature, somebody is going to suffer with the measles. Now, can I adjust the dose of the measles? Because in the natural diseases, the dose is not really in the hand of the physicians at all. Means you cannot increase or decrease the strength of the natural natural disease. So these are the important points to be understood. Keep in mind that all these kind of diseases which are naturally occurring, on these 5 points, you cannot leave the suffering humanity to the naturally occurring similar diseases, though stronger. But beside all these points, we make a very splendid and wonderful learning from the interaction of natural diseases that for sure the similarity cures. So we can very well decide upon the therapeutic law, the third point of aphorism 3. We can rest assured with the concept of law of similia that it is in any way going to be the curative law, and there is none other than this law of similarity which can cure something, some disease rapidly, readily, surely, permanently. When you say permanent, it means the permanent restoration, nothing more. If we leave the word restoration, the meaning of the permanent is taken out differently. It is criticized that there is no such permanent existence of the human being here on the earth. How can he be permanently all right? The point is that it is not that permanent, it means the permanent restoration. When you use the word together, permanent restoration, it does not imply the permanent existence of the person on the planet. It means that he suffered something and his recovery is now permanent, means that he is not going to suffer with same disease or sequelae of it. He became all right. Now he is healthy, doing whatever his work. So we should not really misunderstood the writings of the Hahnemann, which has been wrongly understood, misunderstood by many because of very hasty reading, because of very selective and purposive reading. You have a purpose to criticize, you have points. You select and criticize. So this is the understanding he's going to give us, that what are the disadvantages. There are 5 points for the disadvantage, and every one of us should really understand this, that even after knowing this, that in the nature only similarity cures. It never meant to simply leave a suffering man to the stronger similar natural disease only, because it is not safe, it is hazardous. We are not sure how much duration he is going to be all right. We are not sure about the management of the dose in the given case, and at the same time we do not know how far he is going to be cured, though we make him subject to some stronger natural disease. There are these 5 points we must understand. What is the table of contents says? The table of contents in Aphorism 50 says, nature has but few diseases to send to the homeopathic relief of other diseases. We have, as far as number of diseases are concerned, they are very less for the purpose of cure. And these its remedial agents are accompanied by many inconveniences. I told you five inconveniences. First of all, including the limited number of natural diseases. One is number, second is the safety, third is the duration, fourth is the dose, and fifth is the that how many number of diseases are going to be cured. All these inconveniences are there before the physician. He cannot opt to make the suffering humanity subject to stronger, similar, natural diseases only. And with this aphorism 50, he just closes one topic, the interaction of natural diseases. And in that, he established with all the illustrations and understandings of the principle that it is the law of similia which is going to be curative. Learn this. He ended with the aphorism 50 to make us understand that whatever may be the situations, all right, we cannot leave the suffering humanity just to the natural diseases to be cured. But nevertheless, we learn that patient is only going to be cured with the symptom similarity. We have to find ways and means that how we can create such stronger natural diseases to cure. But then we are not really groping in dark anymore. We understood the law. This much we have to grasp. So let us just read and try to understand more finer features and the finer prints of the aphorism 50. It starts with aphorism 50 says, mighty nature herself has. You see, mighty nature. All right, the first word starts with the capital word. Mighty is with capital M. But nature is with capital N. And he says herself. If we all say it as Mother Nature. This Mother Nature, as we see at her command, as instruments for effecting homeopathic cures, little besides the miasmatic diseases of constant character, in bracket the itch, measles, and smallpox. And in smallpox, he has a footnote. That footnote says, and the exanthematous contagious principle present in the cowpox lymph, morbific agents, which, again a footnote, namely smallpox and measles, as remedies, are either more dangerous to life and more to be dreaded than the disease they are to cure, or of such a kind like the itch that after they have effected the cure, they themselves require curing in order to be eradicated in their turn, both circumstances that make the employment as homeopathic remedies difficult uncertain, and dangerous. This is the one sentence we have to decode, understand, make the right way of utilizing the meaning of it. So, mighty nature herself, this mother nature, how many medicines are there at her command? As instruments, means as the medicines for homeopathic cure. How many instruments or how many medicines this mother nature is going to have? We're talking about the number. How many number of medicines this mother nature has got to be called as the instruments or the medicines which are going to affect the homeopathic cure of other natural diseases which are similar. Animal says little, they are very less. When you say little, little means that something in size and amount and like this. Even Hahnemann is writing a little. Little and a little has got a finer difference. Little is almost negligible to, which is almost equal to negligible. And when you say a little means at least some you have. So he is writing little. We have, and nature has got little medicines for effecting the cure, homeopathic cure. What are those? He says, besides, there are two things to understand here. There are two words which look alike and we may mean alike. Beside and besides. When it is beside, it means you're talking that something is displaced. A change in the location. Beside is something changing in the location. When you say besides, then besides means that in addition to. So he says that we have little number of medicines. Besides means just adding the following, the miasmatic diseases of constant character. We need the diseases of constant character. In that, he is telling the first name of such disease is the itch. And that too in parenthesis means, yes, it is of some constant character, but still, Hahnemann says in parenthesis means that I am really doubtful, little doubtful, I'm not sure about it. So he put that itch as one miasmatic disease of constant character may be utilized by the mother nature, one of the instruments, one of the medicines for effecting homeopathic cure of many diseases. But then he is quite sure about another disease, measles, smallpox, or cowpox, because he knows that these are the diseases constant character, means their features whenever they come in somebody, their features are almost the same. It is that you can understand the same way. Whenever you prove brainia, it is going to show all those symptoms which so far we know. Similarly, we need such diseases. We don't require such diseases as instruments, as medicines to effect homeopathic cure, to achieve homeopathic cure, where the symptoms are ever changing. Suppose, just think, if we come to know that brainia with every location, place, country, caste, creed, it is going to change symptoms. Can you trust such medicine? Of course, we cannot. Whatever may be the place, area, um, weather, Brainia is going to produce dryness. Brainia is going to produce the anxiety for future. Brainia is going to produce the uh, desire for rest and aggravation from any emotion. Anywhere, wherever you are going to prove this medicine, these are the most and chief characteristics which are going to be presented. So we need natural diseases as instruments, means as medicines. What for? For achieving homeopathic cure. Such natural diseases should be having a constant character, means it must be showing symptoms everywhere, in everyone, at every place. The constant symptoms, the same symptoms. Should not be changing around here and there, because such natural diseases are of no such use as a instrument, as a medicine for effecting or achieving homeopathic cure. So the miasmatic diseases of constant character, the itch, measles, smallpox, morbific agents, which as remedies are either more dangerous to life and more to be dreaded than the disease they are to cure. Means somebody will think that I am suffering with the herpes and this patient requires measles, and doctor is going to make an arrangement to cause him measles. Doctor and patient has to think, being stronger disease, measles being stronger disease, more dreaded than the herpes. We are going to cure measles, we are going to cure herpes with the measles, but now patient is suffering with measles now at this moment. Herpes gone, measles there. What are going to do? How are you going to cure measles now? That's what he's saying. Are either more dangerous to life and more to be dreaded than the disease that are to cure, or of such a kind that, like the itch, that after they have effected a cure, they themselves require curing in order to be eradicated in their turn. So there are 2 points here again. He says either and or. Either it is dreaded one. The treatment is rather more harmful than the disease. 1 point. The horrible disease we are going to introduce. And the second point is that what is the way to remove that disease from which we are curing the previous disease. That is the second point. Both circumstances that make their employment as homeopathic remedies, both circumstances means either it is dreaded or how you are going to remove this disease which you utilized as a remedy in both circumstances that make their employment as homeopathic remedies difficult, uncertain, and dangerous. First of all, it is difficult to create the disease, first of all. Secondly, it is quite uncertain and above all, dangerous. 3 points. Are you going to maintain the lab of the viruses? Means in today's time, in Hahnemann's time, it was really difficult because how could they maintain measles somewhere? Nowadays possible. So in his time, in Hahnemann's time, it was uncertain as well as difficult. In today's time, the word dangerous is much more important because the rest too can be managed. But then it is dangerous, inhuman, and unethical. This is the one point we have covered so far. One point means two things we have covered out of the five. One, the number of diseases Mother Nature has got very less. And the second point is that doing such thing is unsafe. Then he says, and how few diseases are there to which man is subject that find their similar remedy in smallpox, measles, or itch. And the second point he says, and how few diseases are there to which man is subject that find their similarity in a smallpox, measles, or itch. In these diseases, a small number of diseases of the mankind can be cured. You cannot cover all the n number of diseases the human race is suffering with all these three diseases, natural diseases. Hence, in the course of nature, very few maladies can be cured by these uncertain and hazardous homeopathic remedies. He is now concluding all these points. He says, hence, in this course of nature, if we leave the things to the nature, how things are happening in a very natural way, if you leave the things in that course, very few maladies can be cured. Only a very few number of diseases of the mankind is possible to be cured. That too by a very uncertain and very hazardous homeopathic remedies. Who can believe, who can say that it is a art of medicine? You cannot name it as art of medicine. And the cure by these instrumentality is also attended with danger and much difficulty, says, and the cure by their instrumentality means if suppose very few number of diseases are going to be cured, these kind of cure by such kind of medicine, instrumentality means those medicines, natural diseases, is also attended with the danger and much difficulty. It is attended with lot of danger and much difficulty for this reason that the dose of these morphic powers cannot be diminished according to the circumstances. So, all right means the uncertain, hazardous medicines you are applying, and that too, the dose is not in your hand because it is naturally occurring disease. But the patient afflicted with an analogous malady of long standing must be subjected to entire dangerous and tedious disease, to the entire disease of the smallpox, measles, or itch, which in turn has to be cured. So the point is, similarity is with the certain symptoms. Suppose, for example, patient is suffering with the blindness because of the corneal disease, and now you know that smallpox produce the blindness. Patient came to you only with the blindness due to cornea issue and no other such condition. And for that, you applied him smallpox. Yes, it may. it may, not sure, may cure the blindness. But now he is subject to the whole symptomatology of the smallpox. Just imagine how difficult it is going to be. How are you going to manage rest of the disease? Because now smallpox has to complete its course. That's what he's saying here. But the patient afflicted with an analogous malady of long standing must be subjected to the entire dangerous tedious disease, to the entire disease of the smallpox, measles, or H, which in turn has to be cured. Means buying a more longer and dreaded disease for one such conditions to be cured. Even if you are able to cure that condition, what and how are you going to manage rest of the symptoms? But then another point, and yet, as is seen, we can point to some striking homeopathic cures affected by this lucky concurrence. All so many incontrovertible proofs of the great, the sole therapeutic law of nature that obtain in them, in italics, cure by symptom similarity exclamation. He said, all right, beside all these points, yes, this is true that these are the disadvantages. We cannot leave the suffering humankind just for the mercy of the mother nature, because it is beyond the realm of the mother nature. But then what we can learn out of this, that seeing these examples as we saw in Aphorism 46, 11 examples, what are they? They are the lucky concurrences. It is a lucky kind of concurrence, means a consequence, a kind of, you can say, occurrence. Lucky occurrence has occurred. That patient was going to have whooping cough and he got the attack of measles because the measles epidemic was also going on. Now, when that occurred, there the observations is made, and in that observation, we are going to have one incontrovertible truth, that similarity cures. These examples of 46 are to make us all aware and understand the effectiveness, the curativeness of law of similia, and not just to make it one only way of treatment, means leaving the suffering mankind to the nature and just simply pray that let this man suffer with smallpox or such disease so that his disease is going to be cured, or physician is going to do something to cause him such disease. It is not going to be in any way the right judicious art of healing. It cannot be. But we are able to learn from this the incontrovertible truth, a truth which is not at all controversial. Incontrovertible means which is not controversial, which cannot be converted the other. So, all these examples are going to teach us that how all these points are going to make us understand the truthfulness, the effectiveness, the sole effectiveness of the law of simile. This is the point we are going to learn out of these examples we have just completed in 46. Out of these interactions of the diseases, we learn 2 points, that when there is a dissimilar diseases meet together, no one can cure the other one. And in the similar diseases interactions, the stronger one definitely cures the weaker one, but it cannot be the therapeutic modalities. It cannot be the art of healing. It is only to learn about the law which we have been discussing right from aphorism number 22. We raised that there are two ways, two laws, contraria or similia. Which one to follow? Here in aphorism 50, with these italic four words, cured by symptom similarity, he concluded. He concluded here with a caution that all right, we learnt the law. We learnt the law from the occurrence in the nature. We learnt the law, whatever the interactions of the diseases occurring, we are just simply learning the law. Now, from 51 onwards, he is going to make us understand that all right, now after learning the law, is there any way that you can apply this law as a physician? How are you going to apply this law as a physician? How are you going to apply it? Now, he is going to teach us from 51 aphorisms onwards that how, when you are going to apply different medicines according to various laws, we know the two law, that is similia and contraria, right from 22. But there are two other law on which medicines were applied in the history, that is isopathy and allopathy. So from 51 onwards, he is going to teach us the superiority of the law of similia in the therapeutic modalities. He told us that basically there are four therapeutic modalities, four ways of applying medicines he found out in the last 2500 years. What? One, homeopathy, which he told, he observed, no one observed. If somebody observed, they simply hinted, they could not catch it, fix. Then he found that without really understanding, they are applying allopathy or antipathy. The antipathy has been utilized, which gave certain kind of immediate results, but then very hazardous after effects. And another modality is isopathy, which he has not given much importance in the aphorism. He just kept it in the footnote only. And that is why right from 22, he was just with the two modalities of the law, that is similia and contraria. But they are in the nature. He says, you may question that in 22 he is talking two, but then in 51 onwards he's going to talk four. Why? Because in the nature it is only two which are applied. Nature only applied two. Mother Nature is so kind to make us understand only two law. The rest of the two law, that is isopathy and allopathy, it is man-made and only to harm the race, human race. But then when he is going to talk about Mother Nature, he is saying only two. When he is going to tell us what man is doing, posing himself as a physician, he did four ways of application of the medicines. And from 51 onwards, he is going to tell us the details of all these four therapeutic modalities. And thereafter, he is going to finally establish that even in the therapeutic modalities, it is only the law of similia as a therapeutic modality has got a superiority, and a physician, the intelligent one, is going to choose only the law of similia and going to apply now onwards medicines on the basis of law of similia only. And he gave a little bit of importance to law of antipathy in the aphorism 69 footnote, in special circumstances for a very special reasons. So from the next class onwards, we will be going further into this. So as I told you in my very previous lectures, that to make us understand the therapeutic law, Henman made it into three different areas to make us understand. One, that within the nature, he observed it is the law of similia, which is the homeopathic law, which is given in aphorism 26 and its footnotes. Then he made us understand the superiority of law of similia in the natural diseases interaction. And the third area is the therapeutic modalities. That means when you're applying medicines to the diseases, he made us to understand that out of the four, it is the law of similia which only cures. So this is how he is going to make us understand the third point of aphorism 3, and rest of the points of aphorism 3 are nothing but the finer modalities, finer understandings, the finer points of law of similia. That is regarding the dose and everything. You know that everywhere he is been talking about the dose, the strength of the medicine. So I believe that this is quite clear, every one of you, that this aphorism 1 to 70 is this much about. But we find so much of elaboration, sometimes we feel lost. But the way I tried put before you after learning from my teacher, Dr. Alim Khan, that this should be the way of understanding the organon, especially the doctrinal part. And once every homeopathic physician is going to understand this 1 to 70 like this, he is going to be very much clear, crystal clear in their understanding that it is the understanding the disease, that it is dynamic. And there are points how to reach, how to understand the disease by way of symptoms through your senses. Then you have to understand how are you going to understand the power of the medicines. And third, how you are going to, on what basis, on what law you are going to apply this power of medicine to the knowledge of disease symptoms. The whole of these aphorisms, which covers the dose of the medicine and everything, that all these basic principles of all these are nothing but doctrinal part. So in any way, do not underestimate the aphorism 1 to 70. In my very humble opinion, if you are not really going to imbibe the wisdom of 1 to 70, then from 71 onwards, that is the methodology of application, that is the knowing the practical part of doing homeopathy, is going to be very, very difficult to understand. I would say impossible to understand. So please take care of it, learn it, give this whole understanding of this aphorism 70, so that 71 onwards things are going to be easy and simple for everyone. Thank you, everyone. Let's see We are going to discuss 51 onwards from the next class. Thank you so much.